The drugs that we have at the moment are anti-seizure drugs. They prevent you from having the symptoms of epilepsy, which are the seizures. What they don't do is prevent the epilepsy. And so what we need is anti-epilepsy drugs. And at the moment, as far as I'm aware, we really don't have any. We've got a few newer drugs that seem to be looking very promising in terms of outcome, but they don't do anything other than the drugs that we already have. So it's a challenge, because how do you prevent people from developing epilepsy? Arguably, you don't treat the seizures; you treat the epilepsy before the seizures become too prevalent, and that's going to be very difficult to do regulatory trials with, because at the moment we're treating the pain, if you like, not the cause of the pain. And we need to know more about the actual cause of the seizures in order to prevent the development of epilepsy. And I've been doing this since I would say trials since about 1985, so 55 years. And we're saying the same things as we were saying when we started out. We haven't really got that further forward. And the newer anti-seizure medicines that we have at the moment, some of them are better tolerated than some of the older drugs, but they're not more effective. And at the moment, we don't have the drugs that prevent the epilepsy. So we're trying to, at the moment, we treat the population of people with epilepsy, and what we need to do is to try and find drugs and methodologies to treat the individual patient. So if you come in with a particular seizure type, I know what the best drug is for you and how I'm going to treat you. At the moment, we can get about 2/3 of patients seizure-free long-term. About 25%, we never get them seizure-free. And we can sometimes get fewer seizures. They can be less invasive, but we never actually get them seizure-free. And the other group, 15% or so, relapse and remit. So for a while they do well, and they can be seizure-free for some years, or the other way around, they can not be seizure-free for some years, and then they're seizure-free. But we never have them completely relaxed and seizure-free. And every now and again, there'll be another seizure coming up, or another group of seizures. And of course, they can't drive their car and things like that. This pattern, no one disagrees with. This is work that we've published. The first paper came out in New England Journal in 2000.